Hello, my name is Dr. Ruthie. Dr. Ruth Newsdrifter, if you insist. I'm a professional sexuality educator and I blog over at exploringintimacy.com. I'm also the author of The Nice Girl's Guide to Talking Dirty. But today I'm here answering questions from moms about sex and intimacy, thanks to the great folks at FunWaresStore. So happy Mother's Day, happy Mother's Day month, and I'm so glad for all the great moms in the world and all the hot moms who are keeping it as active as they want to, or at least trying to move in that direction. So let's answer a question today, just from moms. All of this month's questions are specifically from moms. Some are specifically about momming, and some are not. But when you're a mom, pretty much every area of your life is impacted by being a mom, so it all ties together. Here is a question that we got in. This is a good question. What I would like to know is, how come my body doesn't respond to stimulation like it used to? I feel like nothing is as intense as it used to be, and I don't know what's wrong with me. Am I broken? Thank you so much for saying, I'm a little verklempt over the am I broken part. Feeling the pain right here. Okay, so no, you're not broken, and we're going to explore why this might be happening. In fact, what I want you to know is what you're describing to me is extremely statistically normal. That means that we expect this to happen as we age as women, and we expect this to happen. Well, we expect sexual stimulation to feel differently after we have a baby. That can be lots of different ways. It doesn't always change in the same way for all women, but it is an expectation that it is likely to be different after we give birth. And this is for a lot of different reasons. Our hormones are different, our body's different. But you know what? Excuse me for not being delicate, but if you have been pregnant, even if you didn't give vaginal birth, your reproductive system, also called your pleasure system, has been through hell. And if you have had a vaginal delivery, then you would agree with me that definitely it has. And if you haven't, you would probably agree with me anyway. So that area of your body has suffered a little bit of trauma, delightful trauma, necessary trauma, life-giving trauma, traumatic for those body parts, all the same. And so we expect that they'll be a little different afterwards, just as all of us are different when we go through an intense experience, just like your life is different now that you're a mom. So hopefully that puts you a little bit at ease. Now, if you really do feel like something is wrong or broken, please go see a doctor and get that checked out. And if you're not comfortable telling that to your doctor, then call around and get suggestions from other folks until you find one that you do feel comfortable asking that with, or as comfortable as you can, comfortable enough to do it. But I hope that recognizing the normalness of what you're asking is giving you a sense of calm about that. Now, what do we do? Okay, so now we know it's different. That's normal. What do we do with that? Well, it means that you get to have fun rediscovering what it is that makes you feel hot and turned on. And here's my suggestion to you. If the stimulation isn't feeling as intense or it's not feeling like anything, there's a couple of things to consider. One, definitely consider whether there's any depression going on. When we cease to enjoy the things that we used to enjoy, sometimes that can be a result of depression. And that can actually alter how we feel sexual stimulation and make it feel like wet noodle nothing. So definitely, get checked out for that. There's online ways to see if you need to get checked out by a professional. But consider that. Bring it up with someone. Another thing to consider is that it's oftentimes necessary to have more intense stimulation in order to really feel it. And for some women, it means that they start with stimulation and then they become aroused. That stimulation may be kissing, or it may be direct genital stimulation, and the touch brings the arousal instead of the pattern that we're used to, where arousal first and then we say bring on the touch. That's okay. There's nothing wrong with that. And as you learn your body and this new pattern, you learn how to work with it and work it into sexy situations. You learn to trust that your brain and your heart wants sexual stimulation, and if you begin that, your body is likely to catch up. And if it isn't, you deliver some sort of effective communication of what you'd rather have instead. It's okay. You can always change your mind. Take a look at sex toys that deliver really strong stimulation, that hit the G-spot. I got lots of videos on finding the G-spot, so definitely check those out if you don't know your G-spot well, or if it may be different now. Of course, we always want that good clitoral stimulation. That is what works for the vast majority of women for orgasm. So we want to have possibly more intense clitoral stimulation, possibly more intense G-spot stimulation. That usually means pressing against the G-spot. More intense vibration of the G-spot can be good too, but really G-spots tend to like the pressure. And it also means that whatever's inserted, if you're doing play with something inserted into your vagina, is oftentimes just gonna need to be bigger. And that's okay. That's a powerful vagina that knows what it wants, and there is nothing to be ashamed of about that, that's for sure. So it may be that the intensity of the pleasure that you're getting is coming more from toys and from manual stimulation than it used to. Maybe oral stimulation is not strong enough anymore. Try it, find out for yourself. Maybe intercourse is a great bonding activity and it's sexy in many ways, but you just don't feel it like you did. Hey, and that's okay too. You can still get all those other wonderful things that you love about intercourse, have lots of pleasure with toys and hands, whatever works for you before, during, and after intercourse, so that intercourse can stay a part of your life if you both want it to. It doesn't have to if you don't want to, but you're like sandwiching it with other stuff at the times when you do include intercourse, if you do. So we're talking about like plug-in sex toys, the ones that plug into the wall. Those tend to be the strongest ones. Make sure you get ones you can clean well and all that good stuff that are comfortable for you. We're talking about nice girthy insertables if you're going to do those, that have a nice curve and relearning your G-spot or meeting it for the first time if you didn't get to meet her before. And nice, strong, intense clitoral stimulation and good lubricants. Because you're doing stronger levels of stimulation, we want to make sure that you have good lube going on so we're not getting chafy or anything like that. Now, not everybody needs lube. I think it's just good to have around so that you have it if you need it, because it really stinks if you want it and it's not there. So getting comfortable with that, getting a good pump bottle so you can just reach over and get some like you could some hand lotion. Don't use hand lotion for lube. I just mean with the easiness of getting that off your bedside table, so that you can include it without a lot of fuss. And having fun exploring that, you know, it's important to come to it with that mindset of saying, you know what, this is cool. This is a new opportunity for me to explore what I like about sex. You know, everybody wants to go back to those teenage years when sex was crazy and they were learning what they love, you know, if you were having sex then. And this is an opportunity to go back and rediscover your body. You are going to find stuff that feels good. You are going to find stuff that you enjoy. Trust that that is real and it's going to happen. You just have to discover it. And that may mean unlearning how you did sex before and relearning how you're going to be doing sex now. I'm Dr. Ruthie. I hope this helps for you. Go and be pleasured, and I will see you at the next video.